Let's speak now to Business Unity South Africa CEO Coovadia, who's joining us. Good to have you, Kes, and thank you very much for your time. You participated in the Presidential Health Summit in 2018. You then therefore went on to participate in that initial compact, and we'll outline what it is all about. But now there is a second one that they're putting together. It seems you would have participated in the meetings of putting it together, made some inputs, but when you saw the draft, it did not include your inputs, but two, it centered around NHI, and you then therefore took it back and said, we're not going to be a part of this, let's engage on this a little bit more. They did not come back to you. They went ahead and postponed, but had the signing anyway today. Why do you think that could have been the case?
Well, I don't know why that would be the case. I mean, we have indicated that we want to engage on this. That's what we wrote to the presidency about. We, as you say, we were part of the first health compact. We participated in that constructively. We would have been part of the second health compact. We would have been ready to sign. But when you have a situation where a draft is sent to you 2 days before the signing ceremony, that draft does not look anything like the discussions you had in April. And on top of that, the government makes the National Health Insurance Act as a fairly central element of this compact, when we have publicly said that we have problems with the Act in its current form. We are continuing to engage on that. And we, even the minister at the signing today said that the president would have pulled together a meeting, but his diary did not allow, and he was ill. Well, if the president wanted to pull together a meeting in the diary and his health didn't allow, he could have postponed this until a meeting took place. Anyway, they decided to go ahead. We would still be willing to engage, but we cannot sign a health compact that has at its center the National Health Insurance Act, which we have a problem with, and we still want to engage with government to see if we can amend sections of that act.
So of the first compact, I mean, what would have been your comments in terms of this new one that you would have wanted to be improved? There were 9 pillars of support: ramping up infrastructure, steadily improving the quality of health services, better financial and information system management, good governance and community engagement amongst the issues that would have been raised. Also, the important role that the private sector would play in this. What were your comments?
Yeah, no, generally we were in agreement with that. We had a few tweaks here and there. But what really threw us off was the fact that 2 days before the event, we get a health compact that has national health insurance at its center. And that's the main reason we haven't signed. Yeah. We believe that the national health insurance discussions should be separated from the compact, that we could have signed the compact and we could have started implementing the compact. But when you put in the compact something that's where it is patently clear we don't agree on between government and business and others, then to still expect us to sign the compact, we believe is unreasonable. And that's the main reason we haven't signed the compact.
So the things that, for example, the Deputy President would have raised that would have been the yields of the first compact, you fully agree with them in terms of what has been achieved. That it certainly is something that can yield some positive results. He says, I mean, part of the first compact was the implementation of the National Quality Improvement Plan to ensure that more public and private facilities meet the Office of Health Standards compliance requirements, and saying that is pretty much in line with the NHI. Would you be in disagreement with that?
No, we are not against the NHI, and we've made that very, very clear, that we believe the NHI, if appropriately amended, could be a good piece of legislation to put us onto the path for universal health coverage. So we're not against the NHI. We are against certain sections of the NHI that make that create an environment that actually crowds out the private sector instead of crowding in the private sector. The government still has not explained how it's going to fund the NHI. We've been absolutely clear that you can't fund it through increases in taxes. National Treasury has said that the fiscus doesn't have the money for this. So where does the money come from? And then we have some procedural challenges. We are absolutely clear that both in Parliament and the NCOP, procedures were not followed. The NCOP simply took the act from Parliament, ignored all inputs, ignored all comments, and sent the act back without any amendments whatsoever, including comments from some provinces, by the way. So there are issues with the National Health Insurance Act. We believe that if we are able to engage and we are able to talk about those issues, we can actually deal with those issues. Yeah. But to try and get us to sign a document that endorses fully the act as it stands now is disingenuous. Yeah. When the government knows that we do not agree with the act in its current form. How could they expect us to sign the compact if the compact is seen to be a vehicle through which to apply the act in its current form?
So the president, in his opening address, in follow-up interviews that I would have had also with the Minister of Health, was this expression of a desire and a commitment to engage still on the NHI, particularly with the private sector on the things that you disagree with. So yeah. If you are saying that's the big issue, if for example, the NHI Act aspect of it can be set aside, you're saying you're more than happy then to sign the Presidential Health Compact, the second iteration, if that particular aspect would be set aside?
Not necessarily. We haven't had discussions with government on whether the NHI should be in the compact at all. So we need to discuss that with government. It's not a question of if the NHI tomorrow gets amended that we'll sign. There were no discussions with us about putting the NHI into the compact. No discussions with us whatsoever about that. And so that's why we're saying separate the compact from the NHI. Let's settle the NHI in discussion and so on. And then let's sign a compact that we all agree on. And then you can start implementing the compact.
Yeah. From the minister today, you're saying, they're saying as soon as the president's diary might be opened, so you're likely going to have that engagement. So you could still be a signatory to this compact should that engagement take place.
Sure, we could be. Depends on how those engagements go and where those engagements come out. I'm not going to preempt engagements that we haven't had, but we are absolutely committed to engage on.
Coovadia, appreciate your time. Thanks so much for coming on. That's the CEO there of Business Unity South Africa on the Presidential Health Compact.